We are going to go ahead and get started. All right. So, next. All right. How's everyone feeling? Are we good? We're good. All right, perfect. So we have had a morning full of insights into 3 of the 5 points. And as we thought about what we wanted to do next, there is an entire other angle. And Chris Howard put it in terms of, I'm an engineer, I'm building things. I don't know where I necessarily fit within the 5 points of healthcare. Good question. Where Cambia Grove comes down to that question is that a lot of people who might not be employed by the 5 points, who are innovators in healthcare, could be as entrepreneurs and other innovators within large tech, within large companies. They're developing tools and resources to be used in the 5 points of healthcare to deliver better quality care at a lower cost. And so what we have done today is I am thrilled to be able to have some of my my favorite people,
Pause because of me.
No. No, some of my favorite people from across the country come here to join us to talk about the landscape and the ecosystems of innovation from across the country. And each ecosystem is a little different, as well as each stakeholder group that's represented up here is a little different. And so we'll have Taha, Haley, and Nick give a little description of what they're up to, but it's just such a pleasure to have them here. In true spirit of innovation, they're going rogue. And we had a whole set of questions, but what we're gonna build off of this panel is as much audience Q&A as possible. And so I've got 2 questions teed up, but I'm looking at the mic runners. We will start with audience Q&A as soon as possible. But first off, all right, so we're going to go down the line, and Taha, give us an idea of what you were up to at HealthX Ventures.
Yeah, so hello, everyone. My name is Taha Jangda. I'm a general partner at HealthX Ventures. HealthX Ventures is an earlier stage, late seed Series A fund based out of Madison, Wisconsin. Reason why Madison, Wisconsin is very relevant is there are probably people here from Providence and other places that are very frustrated with a large tech company there called Epic. We are the venture fund in town and work with a lot of organizations, but we invest all across the country. So we're on Fund 2 right now, and we've been excited to come to the space and also look across the country and work with others. A large part of when you talk about stakeholders for us is we're a little different. So one, we're a venture fund, so we have to keep up certain financial metrics and returns to our investors. But because we're in healthcare and because of some of who our investors are, we have very strong relationships with a lot of provider organizations across the country. Just for example, in terms of landmass, Epic has 96% of academic medical centers across the country. So heavy populations, and especially with organizations who are really have the capacity to cut a lot of checks to work in innovation. And then also work closely with, as real world evidence becomes more and more critical to the industry, we've been working a lot with both pharma and payers as well. So seeing a little bit of everything, I'll pass it off.
Fantastic. Haley.
So, and you'll have to excuse me, my voice keeps going in and out. So I run an organization called the Nashville Healthcare Council. Nashville, Tennessee would be considered the provider hub of the US. So we have large headquarter health systems in Nashville. And you could think of us from a provider standpoint as not just health systems, but the delivery of care in many, many different forms and facets. So Nashville has the home of HCA, which is Hospital Corporation of America. They train more doctors, deliver more babies, and do more ED visits than anyone else in the country. We are also the home to Brookdale Senior Living. Brookdale is the largest senior living company in the US. They house more seniors than anyone else in the country. Acadia is a behavioral health. They actually deal with more behavioral health patients. It's that kind of scale that we're talking about when you think of Nashville, and it's hands on the patient primarily. So while we have tech that has come out of there, particularly when it comes to who's paying whom, Change Healthcare is the largest financial transaction company in the country. They're headquartered in Nashville. What that means is that we have a whole lot of people doing the business of healthcare. It means we have more data, clinical data than anyone else, more financial transaction data than anyone else, and more genomics because Vanderbilt University has the largest genomics database in the US. So with all of that, and you could add also more purchasing power than anyone else in the country due to the number of huge provider networks that we have. We definitely know a thing about the delivery of care and all the frustrations that that brings. So my organization is the connector and educator for the industry. We're 25 years old, so we are basically Methuselah when it comes to this crowd. We've been around for a really long time. And we are trying to work through problems in healthcare and innovation by coming at it from the big provider standpoint and trying to see where those pain points are.
Cool.
Fantastic. All right. And Haley, she says every time she comes to Seattle, she loses her voice. I take that as a compliment because we have so many cool things going on here that you just talk. Yeah. Nick.
I'm Nick Doherty. I'm the managing director for Mass Challenge Health Tech, and this is really fun to come to Seattle for the first time. So this is a great excuse to come out here, and I'm probably going to lose my voice after this. I'm pretty sure. So a Mass Challenge, our mission is to solve the world's massive challenges through entrepreneurship and innovation. So we started around 10 years ago. We have locations in Israel, Mexico, Switzerland, and a couple locations in the U.S. We run programs. Pretty much, we run a program on every continent other than Antarctica, and we've sent startups to the International Space Station to have their technologies tested out there. So we've done stuff all over the planet and into space as well. So I run the Mass Challenge Health Tech program, which is our vertically focused program around healthcare and technology, bringing these two things together. And what's, I would say, unique about our program is that every startup that gets into our program is matched with at least one strategic partner. We call them our champions. The reason why we call our strategic partners champions is that in order for them to work with us, they have to be ready to be a champion, not as an individual. So it's not the person across the table that's just interested in hanging out with startups. To be a champion, the entire organization needs to be prepared to extend a partnership offer to that startup and to work on a demonstration project during our program. So we've generated, in the last 4 years, over 370 partnerships. The startups have gone on to impact millions of lives, and it's been pretty magical to see how organizations can come together to really innovate. So we'll see the city of Boston working with Harvard Pilgrim, a local payer, to deploy a technology with the City of Boston's employees, where Harvard Pilgrim is paying for the pilot, and the City of Boston is delivering care or delivering a great experience to their employees. So we see not just the startups teaming up with these big organizations, we're also seeing the big organizations working together. So it's inspiring to see, and we just want to see more of it because there's so many big problems to solve out there, and if we work together to solve them, we can solve them. And so that's what we're excited about doing.
Fantastic. So I'm sure you all realize why I said these are some of my favorite people, not just because you're putting innovation in space. That's awesome. Learn something new every time. We also are, the way that we've gotten to know folks is through this organization called Together.Health. And it is a collaborative of about 40 to 50 like-minded ecosystem builders from across the country that are all trying to accelerate healthcare innovation in a way that is more impactful and effective. And so my first question to you has to do with those ecosystems that we're looking at accelerating in terms of the innovation. And it's a question that actually came out of Poll Everywhere. So someone in this room actually had this question. So kudos to you. I don't know who it is. But what are the ecosystem headwinds and tailwinds currently in terms of making an impact with innovation in healthcare? Nick, go.
All right. So we all have tea up here. So I'm going to read the tea leaves and see what's coming. So I think a headwind, I would say I'm curious to see what this rule change is going to do around patient data sharing and interoperability. So currently it's just a pain for innovators to be able to access data. And I think it's also a pain to figure out how to get through the security review process and all of that. So I think these things are getting in the way of innovation. I think sort of the tailwind that's kind of pushing us along is that I do feel like we are transitioning to value-based care. And I do think that you're seeing more alternative payment models. You're seeing telemedicine starting to be paid for in more places. So I think that there's a lot more opportunity now to deliver patient-centered care. And so I think the more that we can do to push that forward, I think the more innovation that you're going to see in the space, because we're changing the way that we incentivize care, and that sort of forces innovation to happen.
Yeah, I think one of the, if we just step back and say, as we look at innovation or anything else, right, what does that look like? And that tends to be digital. And that's really what we've been talking to in our stakeholders, any organization we go to, is how do you increase your digital efficiencies? A long time ago, a lot of our organizations spent hundreds of millions of dollars implementing electronic health records with the dream of efficiency. And now we're at the awkward position of where we want to invest more within our organizations, but we just don't know how to, right? Because those dollars were earmarked from the federal government, and how do we move past that? And I think now, there's a recent survey that the AHA did, around 75% of healthcare organization leaders now understand or acknowledge that they need some form of digital strategy. And I think the biggest issue now is, what is that strategy, right? You have a lot of the technology we use today in our normal day-to-day lives can exist in healthcare. It's just because of the timelines for it, it just takes forever to actually get it implemented, right? And that's where I think the biggest headwind is also the contractual engagements and how we map a return on investment within our organizations, right? Of where if our sales cycle takes us 12 to 18 months just to identify a problem and to then bring in a solution within our organization, generally that's an 18 to 24 month sales cycle. And if it takes that long for us to use the technology of where, I can use it at home and that costs maybe $4.99 a month, for me to justify that as an entrepreneur, and reality is entrepreneurs, if we look at it from a startup level, they only have 12 to 18 months of runway, right? Whether that's an investor's fault or a company's fault, there's two sides of the table on that. But I think what happens is the costs have to be so alarmingly high of where something that should only cost maybe $10,000 a year has to be a $200,000 a year contract because of that. And I think until we step back and say, when we as organizations are looking at our budget cycles as 2 to 3 years in terms of return on investments, that's what we have to do. Because if we look at it year over year and you're looking for that IRR, no stock in the industry, unless you invested in Tesla like 3 weeks ago and now it's like $900, is ever going to return that. And then a lot of times it just goes underneath. So I think that's definitely something that we really have to attack and acknowledge. And then also, what is our existing infrastructure today that we play in, right? How disruptive are you going to be towards the workflow of our organization today? And I think, on the patient panel this morning, one of the speakers talked about net promoter scores. That's something that just does not exist within healthcare today. And it has to deal with the end user. We can be very, very alarming around it as patients and scream that we need value, we need to feel empathy, we need all of this and this. The magical moment between healthcare and technology is that moment of where technology supports that relationships and allows the physician or any sort of practitioner to really have a vulnerable conversation with the patient. And I think until we really figure out how to get technology in, we can't disrupt the workflow. Optimize the workflow then increases adoption and then goes forward. So that was a very long-winded answer, but I wanted to like take it away before I get in trouble in Madison talking about data sharing. So, but we do have an investment called Redox that does data interoperability. So I'll leave that there.
Okay, so from my perspective in Nashville, we are very, as I mentioned, hands-on patient, provider-centric. With that comes a lot of people, and people are notoriously difficult to change. So I think change management is standing in the way in a big way of getting technology adoption to happen. I think that's why you get a lot of frustration out of people working with providers. It's a lot of people that have to get trained and they have to do things differently. And I think that's really tough. And actually from kind of that tailwind perspective, I think some of the real problems that are getting more and more pressing, things like the rural healthcare issues, are going to really drive a lot of innovation and change in the way things are reimbursed, which I actually think can actually accelerate the pace of change. And it's just because we're getting to a point of crisis. I live in a state, granted most of my members do things all over the country, but we have a lot of rural health providers, we have a lot of rural hospitals closing, and this is going to be an issue that can actually really drive change. I think you'll see a lot more with telemedicine and with other ways of delivering care. And I'm going to stop now before.
Yeah, that was great. Show of hands in the audience. How many people are working for a startup right now? Who's got startups?
Woo!
All right, awesome. I'm asking one more question, and then we are going to have open it up to audience Q&A. I can continue asking questions, so don't feel like we're just going to end the panel. But if you, we would like to make sure that everyone's got a chance to ask questions of these folks who come from all over the country. My next question is, what does innovation mean to your stakeholders? And so we've got VC, we've got a 25-year-old organization, provider organization based in Nashville but works all across the country. We've got an accelerator, healthcare innovation accelerator out of Boston that also works across the country. So, Taha.
And in a space.
What? Oh, and in space. Correct. Okay, for that we're picking on it. Yeah, Nick, you
Who
go
wants to come
first.
to our offices in space?
Yes.
We don't have a location in space. I'll say that, not yet. So innovation for us, we see as an operational framework. So we really try to say it's not a buzzword. We believe that there is a science to implementing innovation. We think that it takes in things like design thinking, and then it translates it into an operational framework that you can repeat over and over again. And we're blessed being headquartered in Boston, that we are surrounded by all these great research institutions that have embedded themselves into our program. And our goal is to be one of the world's first evidence-based accelerators. And what we're targeting is really that science of implementing innovation. And we see it as the process of translating a problem or a need into a solution that scales and proves out value. And that really looks at that whole spectrum. So we've unpacked a lot along that. I'm happy to get into any specifics about how either large organizations can work more effectively with entrepreneurs and how entrepreneurs can work more effectively with large organizations. To Taha's point about the 12 to 18 month runway, for a lot of entrepreneurs that are in the room, you don't have to raise money right away. You probably shouldn't until you've validated that you have a real solution to a real need. Just because you have an idea that makes sense doesn't mean that it's a good idea. And I think a lot of entrepreneurs don't go through that process early enough and to get it far enough before they start to raise money. And once you raise the money, it starts the clock, and you start to make really wacky, horrible decisions, and then it can lead to a lot of sadness and regret.
We're trying to be uplifting here. That was
So what I'm saying though is that you can get to that amazing place that you want to get to, but it takes a lot of hard work. So innovation is inherently fun, but that doesn't mean it's not work, and it doesn't mean that it's not hard. And so I think you have to go from that innovation theater to build the culture, but then you have to ultimately implement it, and that's what I get excited about.
Great. Taha, let's go to you next.
Yeah. So innovation with my venture hat is a dollar science, right? It's like a huge green field, a lot of potential business there because that creates opportunities for us to invest in and to get returns. That being said, following on Nick's point, I think there was a real trigger there that you mentioned, which was evidence-based. Seattle has a very large life sciences bio presence that exists. And I think as organizations and as entrepreneurs, we need to take something from life sciences that we haven't taken within healthcare IT. And that is evidence-based medicine and having real, valid, and repeatable results. And I think until that happens, the trust factor will never happen with large organizations. And I come from a large organization prior to the venture side of where that was the biggest issue. The cultural change issue is heavily centered around trust. How can I trust a 2-person company or a 10-person company to come in here? The amount of liability that exists, I would much rather just stay in my lane and go through that path. And that's something that we really have to address. And innovation also requires that hard work, but what it does is it ignites a spark within organizations. But if you don't follow that spark up with actual easy small wins, it'll easily burn out. And guess what happens after that? Your whole organization will be scarred, and there will be scar tissue that no one will be able to move past.
Okay,
Yeah.
you guys.
The thing is, you can get through it.
So I thought this was going to be a little more.
But we're trying to keep it real. We talk about this a lot as
Nick, you started it.
I know. I'm sorry, everyone. I'm sorry. I'm supposed to we're going to the moon. We're going to space. It's going to be great. Don't worry.
How many? Wait. Quick question. How many providers and payers in the room agree with that? Just out of show of hands. Do you guys agree with that sentiment? Yeah. There you go.
I mean,
and entrepreneurs don't hear that enough, right? It's just like, oh, this is the best thing in the world. All right, sorry, I won't be.
But a lot of it.
I'll go good.
Yeah.
No,
a lot of it comes.
I've been a former operator. Nick has as well.
Yeah.
Of where it's very just.
It's
there's
brutal.
a lot of learnings. Yeah.
I mean. Yeah.
Yeah.
So a lot of it we talk about. One of our partners, she was like my point of contact when I was bringing my startup into Mass General Hospital. Her name's Julia Jackson, and she's awesome. One of the things that she talks about is finding the path to commitment. So there's a lot of people that when you go into like a hospital, or just like any of these settings as an entrepreneur, you're going in. A lot of these entrepreneurs think that they have to not tell the truth. Like they have to like prop it up to basically be like the best version of the truth. And that's such a bad idea because then when you're missing the expectations, like everything falls apart. But if you are going in transparent and saying, here's the reality, here's where we are. Let's talk around the table about the path that we all want to get on to solve this problem together. And if you can identify like what are the challenges on your side as the customer or partner of mine that you're going to need to overcome. And then for the entrepreneur to say, this is the reality of where our solution is today, and to have that conversation in an open way, it's like the only way to be able to get anything done. And I think you have to rely on the evidence. The companies that we see that are successful in our program, they can prove that their solution actually makes an impact and it's not fake.
Yeah, sorry,
go for it.
Go ahead. I'll just add, all right, quick 10 seconds then. You have to have champions as well, right? As you're going and pitching within an organization, that's going to be your first of 10 to 12 contacts. Just always keep that in mind. And I guarantee you the champions are doing so much of the selling as well for you on the back end, and really empower them and make sure they understand the value proposition. I think from an investor side and from a purchaser side, if you can't articulate your value proposition, then I'm already checked out, and that's going to happen, because know that 5 or 10 other people also have to take your value proposition and translate it to their organization.
That's great. Haley, I want you to have the
Bring the
last
positivity
word
back.
in this conversation,
All
and then we're going to
smiles.
open it up for audience Q&A. But one thought is the interest between, so we're talking to the entrepreneurs right now to get the validation. Haley, what do your stakeholders think about innovation? Do they want to talk to them?
So they do, but it's hard. It's real hard. for the same reason. Like, they have so much risk. It's people's lives, and that is hard. And so, are you really gonna put someone's life on the line for something that you're gonna invest in? They really need to know, and particularly at scale, because the companies I'm dealing with are at massive scale. So Nashville's a place you come after you've already done well in a couple of academic medical centers, and you've got a validated product that you know can do well and that you know you can scale. HCA has 180 hospitals of varying sizes in a lot of different urban markets. You don't just walk in and say, like, yeah, we got this. We did a pilot with 2 hospitals and we're crushing it. Like, it's a longer sales cycle. And what I've found with my members is that the word innovation is not actually their favorite.
Did you guys hear that?
She's being very nice.
Yeah.
They really don't respond. And if you really want to see them get their backs up, say disruption. Don't say that. There's no reason to say you're going to disrupt anything. You can say that you're going to change things for the better and grow. You can say that you're going to improve patient experience. You can say that you're going to bend the cost curve in a favorable way for them, help them improve their margins. But they don't really want to be innovated on, truthfully. They want to figure out ways to deliver better patient care at a lower cost. And that's what you can help them do. So actually, after 5 years of talking to my board about innovation and having them be completely unresponsive for 5 years, we finally said, what if we talk about industry growth? And they said, that's amazing. We should be doing that. We should have been doing that for a really long time. So I would say definitely, as you think about innovation, I use it in other places. But be aware that it doesn't have a really happy connotation for a lot of people. It signals change and discomfort. So
That's great. All right, audience members, we've got a question. Right, gentleman who's got the mic.
Hi.
You're on. You're on.
Hi. The question that I have is, especially for each of you to think about, what recent investment that you made really had an impact, a company that you think really delivered where it needed to, and what gap do you have today that you'd love someone to show up with and answer so that you could invest in them?
We could probably.
You're the only
there's-
investor.
Yeah. So there's a company that we recently invested in. It's a company called InsightRx. They actually are, we're a part of Nick's program, and we're one of the shining stars as well. So what InsightRx does is InsightRx is a precision dosing platform. So precision dosing at the point of care, where you're taking traditional pharmacology models and electronic health record data and a bunch of other data sets and saying, this is the right dosage for this patient at this time. And then on top of that has a analytics layer over time that allows departments to not only follow prescription trends and titration trends over time, but also an analytics level, population health level of how many people took vancomycin, how long were they on, how well were their dosages titrated, and there's a lot of data that can come out of that. The big appeal for us was they're solving for a problem, and it's not just a solution. I think that is the biggest thing that we look for is fall in love with the problem, not the solution. And then also, when it comes to talking about early wins, I think, precision medicine is a very, very broad brush that everybody has a strategy around and looks after. But dosing is something that is very, very tangible. So that was one of the areas we liked. And, land and expand. They knew how to not only expand their suite of products, but also to grow within organizations and scale that way. So that's, been a success story for us lately, of where now they're, in over 200 hospitals, right? Of where, they've just scaled and took off. In terms of areas where we're looking, I think you had a program with Omkar at LA Children's.
We had the trails competition.
Mm-hmm.
Yeah, Carly with Brainchild Technologies was the winner. with
Awesome.
Omkar.
All right.
Yeah.
That's awesome. And some of the other work that's, I think social determinants of health have become very, very important today, and rightfully so, right? But I think for us, we're looking for a solution in the market, or potentially even building one of where there's an actual platform of where, you know, there's an engagement and education piece. There's something that solves for transportation, food, homelessness. There's a ton of different things that exist there today. And I think our approach to it as an industry has been very, very siloed. So that's something that I'm personally looking for. And I think there's a big need in the market. And there's a lot of payers as well who are able to provide a lot of value. And thankfully, you know, because of some of the work United Health did and then also what Kaiser did, of where they have evidence that shows for solving homelessness or providing housing, what the ROI looks like over 10 to 15 years. So with that, that's about it.
Julie, we only have 5 minutes?
That was fast.
Oh, all right. We have
We
have
talk
5.
too much.
We have
Yeah.
5 minutes. Yes, oh God.
Hi, everybody. My name is Angad Singh. I'm a physician at the University of Washington. I'm one of the clinical informatics leaders at the university, and one of the things is that once you open the floodgates to innovation, you have to figure out a way to navigate that. So similarly, for you, you have to do the same thing. Everybody wants your money. Or everybody wants you to take their idea and say, I want you to support me. So what metrics or what ways do you analyze ideas that come to your table? And what are the ways others on this side of the coin could think about, similarly, how do I think about ideas that come to me on the physician side or whatever side you want to take on the 5-point scale?
So we work with a lot of health systems on that problem specifically. So I don't know if you know Dr. Halamka. He's now at the Mayo, and he would tell us, he's like, I get 1,000 emails a day from people that want to work with me. And I look at his inbox, and he's not joking. It's pretty bonkers, and it's all over the world. So what he worked with us on was we've created this sort of filtering mechanism on the front end where the providers would give us the challenges that they wanted to solve, and then we would source startups from all over the world. And then when the startups apply, we'd put them through sort of the judging apparatus that we have that relies on the mentors and experts in our community. And then we say, here are the top 60 companies globally that, you know, we think could be good for you to work with. And that's how we've helped some of the providers in our community. So what I'd be curious about is, like, are there people in your network or in your community that could help do some of that filtering for you? So there are other programs out there or competitions that you can do for that. I do think that some of the, like, within the health system itself, a lot of it is figuring out you must be this tall to ride for the vendors for your institution. So from whether it's security and privacy to the steps that you need to take for an entrepreneur to get in. So one of the things that Brigham and Women's does in Boston is they have what they call their DIG process. It's their Digital Health Innovation Guide, I think is the name of it. And so for a startup to start to work with them, they have to have a champion already. So there needs to be a clinical champion if it's going to be a clinical solution before they even come to IT. So they have to basically go and kind of collect all of the champions that they need to be able to bring it in, and they have to meet certain standards to even just have the conversation. So I think the better that you can get in putting up front what the you must be this tall to ride is, the better. And part of how you can construct that is by looking at previous projects that were brought through successfully and kind of deconstructing that to say, what's the path to procurement? What's the path to implementation? What have we done in the past? And start to put a framework in place. And I find that allows you to sort of process through and create your own criteria. But it really depends on the culture of the organization, how you've already implemented in the past. And there's organizations out there like ours that can help be that sort of front door, that coach through the process.
Haley, thoughts? No thoughts. I mean, thoughts, but yeah, no. Anything else?
No, I think Nick nailed it.
All right. Last question. Over here. Perfect.
Hi. I was wondering, kind of like a two-part question. I'm wondering if anyone's seen or heard of any startups that are looking at how to connect data records, because within healthcare, I think that's part of the problem. There's a lot of silos with everyone's going on about patient data and tech solutions. Problem is, though, for boots on the ground people, the systems don't talk to one another. So that's a really big problem. You know, you have your Epic, and then you have Provation, and they don't talk to each other very well. So that's that issue. And then the other one, the other issue I'm seeing is the increasing demands of regulatory, more from the management side of healthcare, and if there's anybody that's innovating to assist organizations with meeting those increased demands.
Yeah, so I can take the first part of it. So actually, our first investment, and actually where I used to be an employee of as operator, was a company called Redox, which is a cloud-based interface engine, and they're scaled at well over, I think, 500 healthcare organizations in the country, and have I think 3,000 or more application vendors. And what they do is they're a cloud-based interface engine. So if you're a vendor and you want to communicate with your organization or any organization, you build an integration roadmap once, and then you map it to their data standards, which is on JSON. And then after that first connection is done, you can then go to your second, third, fourth, fifth organization, and it's relatively turnkey because you're mapped on and stuff like that. Now, if you're the organization that did the integration initially, and you want to work with 10 other vendors, if those interfaces were mapped to Redox initially, it's fairly turnkey of where you can just splice the interface feed and you get the data in and out. So generally, first integration today generally takes, I think, 5 to 7 months for a vendor to integrate with a healthcare organization. Redox is able to do your first integration within 4 to 6 weeks. Granted, everything's right on your end. And then your second, third, and fourth will go from 2 weeks to 1 week to potentially a week. So that's, there is a company that is attacking that problem. They also went through Mass Challenges program. I actually did the pitch for Mass Challenge at that day. That was the last thing I did at Redox, so it was pretty cool.
Yeah, we matched them with Brigham and Women's Hospital, and it was pretty cool to see that basically Brigham was having the problem where they had what we talked about earlier, where all these entrepreneurs are coming in and wanting to work with the Brigham, and it was a pain to navigate integrating all these vendors. So essentially what they did is they said, hey, Redox, we're going to integrate with you, and then you're going to integrate with all the vendors. And so now you kind of have this sort of singular relationship between the CIO and Redox for all of these third-party integrations, and it really brings all of the data into one place. And so Redox has done a really good job of that. A lot of our startups integrate through them. There are a few other companies that do have different flavors of integration, and a lot of it's built off of FHIR is a big thing that's happening, and the upcoming rule change around patient data sharing is going to be really interesting in terms of letting the information flow a little bit freer. So a lot of cool stuff going on in that space.
And then on the regulatory side, I haven't seen anything that's really come in to disrupt it. I think because I've had some meetings with the FDA folks around digital health and certifications and software as a medical device, but it's very gray right now. I think it'll take some time. I think in the next 3 to 4 years, you're definitely going to see a lot of kind of momentum that shifts there. And they're waiting really on evidence-based practices that healthcare companies do, digital health companies do today. I think once we have that done more and we have publications, and the AMA actually is working on a project with Together.Health on what is an ROI of a digital health solution today. And as more of these publications happen, I think then we're able to actually map things that are tangible and follow through. And because it's not longitudinal, right? That's the problem in digital health. So, I'll jump.
That's great. All right, so a couple of key takeaways from this panel. There's sadness, and there's
There's a lot of optimism too.
So much joy. But it's just you gotta keep it real.
But there's a lot going on in this space in terms of bridging the gap between entrepreneurs and the traditional healthcare systems. And there's a lot of people across the country in different ecosystems. If you are interested in getting to know Nick, Taha, Haley, I think a couple of you are able to stick around for most of the rest of this conference.
Not Haley.
Not Haley, but also we convene via a network of conveners through the Together.Health collaborative, and so that's if you want any more information on that as well. This is a very exciting industry to be part of it. So please join me in thanking our panelists.